Nature's medicine. The healing power of grounding, earthing. Part 1. The science, the systems, and the silent connection. Friends, let us start with a clinical turning point. In 2019, during one of the most demanding phases of life, establishing a clinical practice, there came a period that many patients describe, yet often cannot fully explain. Persistent insomnia, diffuse body pain, a constant sense of fatigue despite rest. Nights were long and unrefreshing. The body felt heavy, the mind restless. Conventional approaches were used. As clinicians, we rely on evidence-based medicine, and rightly so. But sometimes, certain conditions, especially those rooted in stress, autonomic imbalance, and chronic inflammation, do not respond completely to pharmacological intervention alone. Then came something simple, almost too simple: walking barefoot, direct contact with the earth, grounding. There was no expectation of dramatic change. But over weeks, something subtle yet profound began to shift. Sleep improved, pain reduced, the body felt calmer, more regulated. Now, from a scientific standpoint, this is not proof. It is an observation, and in medicine, we must be careful not to overinterpret. But such observations raise an important question. Is there a fundamental aspect of human physiology that modern life has quietly disconnected us from? The modern epidemic, chronic diseases, and a common root. Over the past few decades, the pattern of disease has changed dramatically. We are no longer primarily fighting infections. Instead, we are facing an epidemic of chronic diseases: cardiovascular disease, type 2 diabetes, hypertension, neurodegenerative disorders, chronic pain syndromes, anxiety, and insomnia. These conditions appear different, but when we look deeper, they share common underlying mechanisms: chronic low-grade inflammation, oxidative stress, autonomic nervous system imbalance, poor sleep and circadian disruption, mitochondrial dysfunction. This is a critical insight. Modern medicine is increasingly shifting from "what disease does the patient have?" to "what underlying processes are driving disease?" Grounding enters the discussion at this level, not as a treatment for one disease, but as a potential modulator of these core systems. The fundamental idea: the body is electrical. We often think of the human body in biochemical terms, but at a deeper level, physiology is also electrical. The heart functions through electrical impulses, ECG, the brain through electrical activity, EEG, muscles through electrical signals, EMG at the cellular level. Energy production depends on electron transport chains. Cellular function depends on electrical gradients. Life itself is driven by controlled movement of electrons. Now consider this. The Earth carries a stable negative electrical charge. It acts as a vast reservoir of free electrons. The hypothesis behind grounding is simple. When the human body comes into direct contact with the Earth, electrons may flow into the body, helping stabilize electrical balance and reduce oxidative stress. This is not yet conclusively proven, but it is biophysically plausible. Section 1. Inflammation. The silent fire within. If there is one concept that defines modern disease, it is inflammation. Not acute inflammation, that is protective, but chronic low-grade inflammation, often silent, persistent, and damaging. One of the most important markers of this is C-reactive protein, CRP. CRP is produced by the liver in response to inflammation. It is widely used clinically as a marker of systemic inflammatory burden. Clinical interpretation: 1 Megazel, low risk; 1-3 Megazel, moderate risk; 3 Mezazel, high risk. Even mildly elevated CRP is associated with increased cardiovascular risk, metabolic dysfunction, endothelial damage. Now here is where grounding becomes interesting. Findings from studies: reduction in CRP levels after barefoot walking, reduced heat patterns on thermography indicating less inflammation, modulation of inflammatory cytokines. This suggests grounding may help reduce systemic inflammation. And this is critical because inflammation is not just a symptom, it is a driver of disease. Section 2. Blood, circulation, and vascular health. Another consistent finding relates to blood properties. Observations: reduced red blood cell aggregation, improved blood fluidity, enhanced microcirculation. Why does this matter? Thick, viscous blood leads to poor oxygen delivery, increased clot risk, vascular stress. Improved blood flow leads to better tissue oxygenation, improved healing, reduced cardiovascular risk. This is highly relevant to heart disease, stroke, peripheral vascular disease. In simple terms, better blood flow means better life at the cellular level. Section 3. The nervous system. Stress versus healing. The autonomic nervous system is the master regulator of the body. It has two main arms: sympathetic, fight or flight; parasympathetic, rest and repair. Modern life pushes us toward chronic sympathetic activation. Stress, screens, noise, sleep disruption. This leads to anxiety, hypertension, poor digestion, hormonal imbalance. Grounding studies show increased heart rate variability, HRV, reduced sympathetic activity, increased parasympathetic tone. This means the body shifts from stress mode to healing mode. This is not just psychological, it is physiological regulation. Section 4. Sleep. The foundation of recovery. Sleep is where healing happens, yet insomnia is now widespread. Grounding has been shown to normalize cortisol rhythm, improve sleep onset, enhance sleep quality. Why is this important? Because sleep affects immune function, hormonal balance, brain health, inflammation. Better sleep, better health. Section 5. Brain chemistry and mental health. One of the most interesting findings comes from studies on serotonin. Observations: increased serotonin levels after barefoot walking. Serotonin regulates mood, anxiety, sleep. Additionally, brainwave patterns become calmer. Mental overactivity reduces. This explains reduced anxiety, improved emotional stability. Section 6. Immune system. Balance, not suppression. Grounding has been shown to affect interferon gamma, IFNG, white blood cell activity. The key point: it does not suppress immunity, it balances it. This is crucial because overactive immunity, autoimmune disease; underactive immunity, infections; balanced immunity, resilience. Section 7. Pain and musculoskeletal health. Pain is one of the most common complaints in clinical practice. Grounding studies show reduced muscle soreness, faster recovery, reduced chronic pain. Mechanisms include reduced inflammation, improved circulation, nervous system calming. Pain is not just structural, it is systemic. Section 8. Mitochondria, the energy of life. At the deepest level, health depends on mitochondria. Mitochondria produce ATP, energy, regulate oxidative stress findings, increased ATP production, reduced reactive oxygen species, ROS, improved efficiency. This is significant because mitochondrial dysfunction is linked to aging, neurodegeneration, metabolic disease. Interim summary of Part 1. Let us pause and reflect. Grounding appears to influence Inflammation, CRP decreased. Blood flow, viscosity decreased. Nervous system, parasympathetic decreased. Sleep, quality increased. Brain chemistry, serotonin. Immune balance, regulated. Pain, cellular energy, mitochondria. These are not isolated effects. These are core physiological systems. Key insight. Before moving to Part 2, grounding does not target diseases directly. It influences the systems that create or prevent disease.
Part 2. Aging, clinical meaning, public health, and human reconnection. Section 9. Aging. Can grounding influence longevity? Aging is often viewed as an inevitable process, but modern science increasingly understands that aging is not just time-dependent. It is biology-dependent. 3 major drivers of aging have been identified: chronic inflammation, inflammaging; oxidative stress, mitochondrial decline. Let us examine how grounding relates to each of these: inflammation and aging. Chronic inflammation slowly damages tissues. Blood vessels, atherosclerosis, brain, neurodegeneration, joints, arthritis, skin, loss of elasticity. As discussed in Part 1, grounding has been associated with reduction in CRP, modulation of cytokines, reduced inflammatory heat patterns. This suggests grounding may help slow the inflammatory processes that drive aging. Oxidative stress and cellular damage. Oxidative stress occurs when there is an imbalance between free radicals, antioxidant defenses, free radicals damage, DNA, proteins, cell membranes. The grounding hypothesis proposes Earth electrons may act as natural antioxidants, neutralizing free radicals. While this mechanism is still under investigation, it provides a coherent biological explanation. Mitochondrial aging. Mitochondria decline with age. Less ATP production, more oxidative damage. Grounding studies suggest improved mitochondrial efficiency, reduced ROS production, increased energy output. This is significant because mitochondrial health determines cellular vitality, and cellular vitality determines aging. Brain aging and cognitive function. Chronic inflammation and oxidative stress affect memory, decision-making, cognitive clarity. Grounding may indirectly support brain health through reduced inflammation, improved sleep, better autonomic balance. Anti-aging summary. Grounding is not a proven anti-aging therapy, but based on current evidence, it may support healthy aging, reduce frailty, improve resilience. Section 10. Integrating the systems, a clinical perspective. Now let us step back and look at the bigger picture. In clinical medicine, we often treat diseases individually: hypertension, antihypertensives, diabetes, glucose control, anxiety, anxiolytics. But increasingly, we recognize that many diseases share the same underlying dysregulation. Grounding appears to act on 3 central hubs. 1. Autonomic nervous system. HRV improves, stress reduces, parasympathetic tone increases. 2. Inflammation. CRP reduces, cytokine balance improves. 3. Circulation. Blood viscosity improves, microcirculation enhances. These 3 systems influence cardiovascular health, metabolic function, brain health, immune response. This is why grounding appears to have multi-system effects. Section 11. Clinical interpretations. What can we actually say? This is where scientific integrity is essential. We must clearly differentiate between what grounding is not a cure for disease, not a replacement for medical treatment, not a miracle intervention. A supportive lifestyle intervention, a regulator of physiological systems, a low-risk adjunct to standard care, evidence status, small clinical trials, positive signals, biomarker studies, promising, mechanistic explanations, plausible. But large randomized trials, lacking clinically accurate statement. Grounding is a low-risk intervention with emerging evidence suggesting benefits in inflammation, autonomic balance, and circulation, but it requires further large-scale validation. Section 12. Public health perspective. Why this matters. Now let us shift from individual health to population health. Chronic diseases are now the leading cause of morbidity and mortality worldwide. Key characteristics: long duration, high cost, lifestyle driven. Public health interventions must be low cost, scalable. Safe grounding fits these criteria. No cost, no side effects when practiced safely, easily accessible. Why it is not yet widely adopted. Despite promising evidence, grounding is not part of mainstream guidelines. Reasons include limited large-scale studies, difficulty in standardization, lack of commercial incentive, competing research priorities. But here is the key insight. Public health does not ignore ideas. It waits for strong evidence, clear outcomes, scalable protocols, potential future role. If validated, grounding could become a lifestyle recommendation, part of preventive health programs, a public awareness intervention. Section 13. Practical application. How people can use it. Let us now bring this to real life. Grounding does not require complex tools. Natural methods. Walking barefoot on grass, sitting on soil, beach walking, gardening duration. 20-40 minutes daily. Safety. Ensure safe environment. Avoid contaminated surfaces. Be cautious with electrical grounding devices. Key principle: consistency is more important than intensity. Section 14. The deeper message, human reconnection. Beyond physiology, there's a deeper dimension. Modern life has created physical disconnection, psychological stress, environmental separation. Grounding is not just about electrons, it is about reconnecting with nature, slowing down, restoring balance. A fundamental thought. For most of human history, we walked barefoot. We lived close to the earth. Only recently have we become insulated, elevated, disconnected. Grounding at home, indoor alternatives. If direct contact with natural ground is not always practical, some indoor options are available that aim to simulate grounding by connecting you to the earth through your home's electrical earthing system. Grounding mats, placed under feet while sitting or working. Grounding bed sheets, used during sleep for prolonged exposure. Wrist or ankle bands, provide continuous skin contact. Grounding shoes, designed with conductive elements to allow contact with the earth. Important points to consider. These products work only if connected to a properly grounded, earthed outlet. Electrical safety is essential. Ensure correct wiring and earthing. Evidence for these devices is more limited compared to direct outdoor grounding. Effects, if any, are likely modest and variable. Practical takeaway: outdoor grounding, barefoot on natural surfaces, remains the most reliable and natural method. Indoor alternatives can be considered when outdoor access is limited as a supplementary option. If you cannot go to nature, you can try bringing a part of that connection indoors, but nothing truly replaces direct contact with the earth. Final integration. Science plus simplicity. Let us summarize everything clearly. Grounding may influence inflammation, CRP, blood flow, viscosity, nervous system, parasympathetic, sleep, improved, mood, serotonin, immunity, balanced, mitochondria, energy, the core, insight. Grounding acts on fundamental regulatory systems, not just symptoms. Closing story, reflection. Think back to the opening story, a phase of stress, insomnia, pain, not fully relieved by conventional means, then a simple intervention, contact with the earth. Was it the sole cause of improvement? We cannot say, but it aligns with emerging science. Closing message. Modern medicine has given us powerful tools, but not all healing comes from complexity. Sometimes it comes from restoring what was always there. The earth beneath us is not just ground. It is part of our biology, and perhaps in reconnecting with it, we are not discovering something new. We are remembering something essential. Ultimate closing line. If inflammation is the fire behind chronic disease, and if the body is an electrical system, then grounding may be one of the simplest ways to bring the body back into balance. Thank you. Founder, Holistic Wellness Foundation, IMFAL, Healing Beyond Boundaries.